Welcome back to Chats with Desiree. Thank you again for joining me. Now, today's discussion, we are going to be talking about Well Baby Clinic or Child Health Clinic. Remember, this platform is used for education purposes, and so we'll be giving you general information so that you can use to better equip yourself. Well Baby Clinic or Child Health Clinic is a health service clinic for preventive monitoring, health education, and advice for parents of children or babies. Protecting and improving the health of children is of fundamental importance. Over the past several decades, we have seen dramatic progress in improving the health and reducing the mortality rate of young children. Among other encouraging statistics, the number of children dying before age 5 was halved from 2000 to 2017, and more mothers and children are surviving today than ever before. However, a great deal of work remains to further improve the health outcome of children. The world is facing a double mandate. More than half of children deaths are due to conditions that could easily be prevented or treated given access to health care and improve their quality of life. At the same time, children must also be given a stable environment in which they can thrive, including good health and nutrition, protection from threats, and access to opportunities to learn and grow. Investing in children is one of the most important things a society can do to build a better future. Now, this is taken from WHO on the Child Health Clinic or Child Health in general. There are many services that are offered in Well Baby Clinic or Child Health Clinic, and most of them or some of them are immunization, weight checks, height checks, landmark developments, hemoglobin checks, head circumference, oral checks, eye checks, education sessions, which includes breastfeeding, introduction of feeds, potty training, and the list goes on. Now, the Well Baby Clinic is a major clinic that all children should be taken to. You take your child to the Well Baby Clinic or the Child Health Clinic, and the nurse immediately starts doing her due. She checks the child head, she checks the child weight, she checks the child height. Now, the reason for her doing that is to make sure that the child is thriving properly. There are guidelines that must be followed. For instance, the child's head circumference should be at a certain number for the child's height or weight. The child's height should be at a certain level for the child's age, and it goes on. So we're not just taking them to tape and just measuring to make sure, or to see if the child is eating, as they say, or to see if the child is being fed. No, their importance for what we are doing. The child at a particular age should be at a certain level or a certain developmental stage, and so we are ensuring or checking to see if that child is thriving, reaching his goals. And if it's not, then we know what to do as well. So we refer that child, we give you certain education tips that you can do to help that child thrive. And if it's still not working, then the child is referred to a pediatrician where for the tests and so can be done. So the Well Baby Clinic or the Child Health Clinic is very, very important. Now, this usually takes place, as I said, in a clinic setting. Within our little island, there are many medical stations and health centers that you can access. The days might be different to others, but to bring your baby to the Child Health Clinic or Well Baby Clinic. I know in Sates it's on Tuesdays, and in other places, it's different days, different places. So all you have to do is just find out. You call your health center and you find out. If you're not sure, the St. George's Health Center would give you information on that, because we are all joined, so we all have access to each other's, and we can tell you, okay, if you're living in Grenville, you go to this station on that day. If you're living in Tivoli, you go to this station on that day. St. George's Clinic is this day. St. David's is that day. You understand? So there is days for different clinics for each different health center or medical station in Grenada. Some people may prefer to bring their child privately, and so if you have a pediatrician that you access, you get your days where the pediatrician checks and you bring your child there for their health checks. We touched based on that the clinics are scheduled different time, and most of the time every well baby clinic is on a monthly schedule basis. So it's either monthly, 2 monthly, then 4 monthly, then 6 monthly, based on the child's growth. If the child is needed to see more often, then a weekly appointment can be given to you as well. But it starts at 2 months, and then 4 months, and 6 months, and 8 months, and then yearly, and so it goes until the child is discharged from the well baby clinic. The objectives of Well Baby Clinic is to deal with the total well-being of children and families at a low cost. Now, this is the government objective, to deal with each and every child, every aspect of the child, the family, at a low budget cost. Sometimes it comes totally free, and sometimes there may be a cost depending on what is needed or required for that child. Other objectives is to improve safety net for health education and for treatment of illnesses, or to catch and treat disease conditions that parents are unable to spot in that child. There are many advantages of Well Baby Clinic. I can't sit here and think of one disadvantage of why you should not bring your child to a Well Baby Clinic or child health clinic. No, I cannot sit and tell you one bad thing that can happen from you taking your child to a child health clinic. No, but I can sit here and give you a world of advantages as to why this child should be seen at a Well Baby Clinic. Most of the advantages are it provides a wide range of services and support for family. It covers a wide range of problems, example sleeping, diet and food, accident preventions, difficulty in breastfeeding, toddler tantrums, potty training. It spots problems that can be dealt with early. It spots disease that can be dealt with early. If that child isn't thriving, it picks it up. If that child needs or requires further medical attention, picks it up. If that child is growing nicely, it picks it up. Whatever the problem is, taking your child to Well Baby Clinic can spot it early and prevent a world of what ifs and shoulda, coulda, woulda, like we see. So yeah, take your child to the Well Baby Clinic. It is just as important as dressing your child up fancy and taking them to Pizza Hut or taking them to up the park, the fun park, and taking them to birthday parties and taking them. This is just as or even more important. Yeah. Now, another major importance of Well Baby Clinic is the vaccination program. The vaccination program in Grenada runs from ages 6 weeks to 14 years. There are different age groups, different vaccines, and it is just as important. Now, I know some people of the opinion and they don't believe in the vaccine and they don't want their children to be vaccinated. And like I always say, we are in the 21st century. You have a choice. If your choice is not for your child not to be vaccinated, that is your choice. If your choice is for your child to get the best health care there is possible, it is also your choice. The education is free, the advice is free. You get up, you read, you decide what you want, as you are the sole provider for that child, and it is your decision until that child reaches the age of 18. Now, when the child starts going to the Well Baby Clinic, they are giving a vaccination or growth chart card. Now, it may not, this is my son's, so it may not be the same card as this one. You may get, I think now it's kind of like a little booklet. It's less cardboardy, so it's more paper-like now. And this is very important that you keep this safe. Just as you're taking care of your passport, your bank card, your land papers, this should be in there with it. This is very important for the child when the child goes reaches the age and is ready to go to university. they are going to ask that child for their vaccines, and it is very important that that child can have records of their vaccine as a child, even if they don't have the vaccine. But there are other important aspects in that card that should be kept safe. For instance, the growth chart, where you have the child's weight, height, hemoglobin, etc. It's all recorded in that child's card. So if the child is thriving, it can be seen here. If that child is not, it can be seen here. And so this is a very important piece of document that should be kept safe and sound, away, hidden, just like everything else. Normally what we would ask parents to do is to laminate it, so that even if water goes onto it, it can easily be wiped off, but it should be kept in a place very safe and sound, so that the child can use in the future. As I was saying, the vaccination program runs from ages 6 weeks old to 14, and at 6 to 8 weeks the child gets, and I'm speaking Grenada setting now, yeah. So at 6 to 8 weeks, that child, which is like a month and a half, the child is given the diphtheria, tetanus, and pertussis, we call it DPT, the polio, the Hib, which is the hemophilia influenza type B, and the hepatitis B. Now this vaccine is repeated through 7 months, so 2 months apart. So the child is given that at 6 weeks. The second dose is given at 4 months, and then at 6 months, right? When the child is 1 year old, he is given the MMR, measles, mumps, and rubella shot, and another dose of the MMR is given at 18 months, right? At age 18 months, the child is given another booster shot of DPT, diphtheria, tetanus, and pertussis with polio, and another one is given at 4 years. So they get the second dose of DPT, tetanus, and polio, right? Which is the first booster and the second booster. And the child gets his last vaccine at age 14, which is a tetanus booster shot. In other countries, other vaccines are added, like the influenza, pneumococcal, meningococcal, and the HPV, which we are now adding in Grenada at age 9 to 13 years, right? Now the HPV is another very important vaccine, and I know lots of people are refusing that vaccine, but I am asking you to go out and get education on the importance of HPV. We know that cervical cancer is leading cause of death, especially among the Black population, and so the HPV is a very important vaccine for young girls, as it prevents the cancer-causing cells. It is important to give the boys as well, as they are the main carriers of that disease. A more in-depth explanation would be given on the types of vaccine that we administer as healthcare provider, as I think it's a very important one as well. Yes, I know that we can go onto the internet and search stuff, but coming from a healthcare provider, I know it might seem as coercion, but we are trained and given more information, so and explaining it to a civilian might be easy.